Hi everyone, welcome to our newest episode of Community Connection. I'm Vicki Casella, licensed professional counselor in Easton, and my co-host Mark Kenny. How are you, Mark?
I'm doing well over here on the Allentown side of the Lehigh Valley.
Okay,
I think we got it covered, east to west.
Yeah, exactly. And it's Friday. Woohoo! Wonderful. All right, so today's topic, trauma, healing from trauma, which right now I feel like we're all experiencing some level of, if you don't want to use the word trauma, stress, anxiety, something with what's going on in the world and who knows, whatever's happening in our personal lives. So I think this is a really important topic for us to be able to share with our community. Before we dive in with our guest, just our normal disclaimer: if anyone who's listening or watching struggling with any mental health symptoms or anything of concern, we encourage you to reach out to your medical doctor, therapist, crisis worker. There's a ton of hotlines out there. So please do so if you need help. Like I said, everyone's struggling right now with something, so you are not alone in whatever it is that you're going through. So our guest, Christine, I'm going to have you introduce yourself so I don't botch up your name. So if you can share who you are and just your position and a little bit of how you're involved with St. Luke's.
Sure. Hi, my name is Christine Catania-Rachlin, and I'm a licensed clinical social worker, and I work as part of St. Luke's Behavioral Health Department as a psychotherapist. And my specialty has been trauma and specifically treatment with EMDR.
Wonderful, thank you.
And so can you share with our listening audience and what are the common types of traumas or presenting issues that come to you that you work and help people resolve and heal from?
Absolutely. So trauma, as you might assume, happens on a very broad continuum, a very long continuum, right? From kind of single incident car accidents or single incident things that have occurred to much larger complex trauma where people have sustained various traumas or consistent traumas like childhood trauma, child abuse, incidents like that. And then there are those, people who have had both complex trauma and single incident traumas. So I work with the whole gamut. I have worked with people who have been in car accidents, horse accidents, any type of situation like that. I've worked with survivors of 9/11. I've worked with military professionals, both men and women coming back from military deployment. And then I've worked with a substantial number of people who are adults or teenagers who have had past childhood abuse.
Thank you for explaining. I very much appreciate how you gave specific examples, because what I notice happens a lot is we tend to downplay something that has occurred in our lives as, well, it's not as bad as this over here, so it can't possibly be trauma, or but if you see something changing in yourself, if you're thinking differently or feeling differently or something just doesn't seem right, it's worth exploring, because it could be more than what you think it is. Just validating your own feelings and what you're going through. So I love that.
Absolutely.
Those examples.
Yes, and I find that to be a big issue for people who are coming in. Right? They, will ask, all therapists ask the question about bad things that have happened or things that have occurred. And 6 to 7 sessions later, someone's telling you about something that happened in childhood or adolescence, and you're like, wait a minute. And they don't look at it as that, because looking at it or viewing it as traumatic has such a connotation then for themselves. And because our society just struggles so much with mental health and how we already look at it, it becomes an even more difficult situation, I think, for people coming in. I am very humbled and honored when someone shares that with me, and that we're able to look at that and help them heal from that.
Sure. It
And,
becomes normalized, I think, in their head,
Mhm.
and then to
Yes.
voice it takes this level of vulnerability and this shame. Like shame, I think, is a huge part of that comes up. I'm sorry, we're just going
Yes.
to stick with this question for the next like 15 minutes because there's so much that's coming up. Mark, did you want to add something? It looked like you
no,
wanted to add.
no, I was
Oh,
thinking this,
okay,
I was nodding because I was thinking the same thing. Keep going, Vicky, you were going down the same path
okay.
I
No,
was going.
I think I'm good with that. There's just, it's so elaborate though, is basically what we're all saying, right? There's so many layers that come up with this that we don't even realize. So,
But I guess one of the things I just want to add is Christine, is one of the things that you're doing in the therapy is helping people, like you, as Vicky said, normalize it, be okay, not feel, get into the shame or to the stigma around it, but really, allow and be welcoming in your relationship with them so that they can explore with you.
Absolutely. The foundation of all trauma work is safety. You have to start at safety. Years ago, Judith Herman in trauma, in her book, Trauma and Recovery, which was really groundbreaking. That first level, that first way that we approach it is always through safety, right? Physical safety, emotional safety. So when someone enters into my office, I am extremely cognizant of ensuring that they can begin to feel safe.
Mm-hmm.
Can you
And that
repeat
becomes
the title
a safe
of that
space
book?
for them.
What was the title
I'm
of that
sorry?
book? The title of that book again?
Trauma, it's called Trauma and Recovery, and it's by Dr. Judith Herman.
Okay. Thank you. So with COVID going on, is it safe to say that that might be like a societal trauma, like a worldly? I don't know. Tell me your
Yeah,
thoughts.
I think
Is that extreme for me to define it? It's definitely
it's
impacting people.
definitely,
Maybe not a trauma, but it's impacting people.
definitely. And then if you're someone who's in a traumatic place, so domestic violence, child abuse, right? All the places that young people or people would go, work, school, to try to get away from that, and where other positive resources are all of a sudden dramatically reduced, right? So I think for people who are currently in a traumatic situation, it becomes quite significant for them, because there's no, all of your other resources have been cut off, right? And if you are living with an abuser, abusers by definition already attempt to cut off resources. Right. So the health crisis and how it's been addressed obviously is definitely impacting that. I think for the rest of us, I definitely think it's an anxiety provoking situation, right? Maybe not unsafe so much, but definitely anxiety. If we're prone to some negative thinking, and then we have a lot of negative thinking, then that could actually, create, panic attacks. It touches off the fight or flight response. And so then you're seeing that type of situation occur.
I was listening to a webinar put on by public health organization out of Stanford, and they were talking about the schools. And they were talking about when the students are coming back to school, and that one of the things that they talked about was that schools need to think about the trauma that their students have experienced, the loss of loved ones or other losses that maybe they've experienced. So would that fall under this umbrella too? Are they using that term trauma correctly when they were talking?
Absolutely. Absolutely. Because remember, for a child, for children, especially younger, elementary age, their brains are at a different stage of development. So how the concreteness of something, right? If someone's been ill, also just the separation of it all, not actually being there to see someone, to experience someone, most certainly that becomes a loss for them. And then how are we processing that loss for them? How are we helping them make an understanding of that in their mind and with their brain, given where they are in their development?
I like the way that you're kind of bringing in that bi-directional piece about the brain and environment, and I guess you want to talk a little bit about how the physiological impact that this all has, and then maybe that can get us into how do you do that healing work then, as you're talking about these
Absolutely.
different
Absolutely.
aspects.
So when an unsafe situation happens, whether it's single incident or over time, like a situation happening over time, we know now because of MRI and CAT scans and all the neural imaging that we have that is so significantly impacted trauma research, that it impacts how the brain works, right? So we take in stimuli through our five senses, and that processes through our limbic system, which is in the back of the brain. And that limbic system has some responsibility for assigning emotional, how emotional it is, right? Emotional safety. So if it's just, hey, I'm sitting in class and taking notes, I'm pretty emotionally safe, right? I might be bored to tears, but I'm okay. So that's going to send that up to our cognitive regions of our brain and assign that to other memory. So other times we've sat in class, because memory is associated. For traumatic memory, that kind of sends our amygdala and our hippocampus, which is part of that limbic system, into a different place, right? It becomes an unsafe, like the smoke alarm of the brain goes off. And then that starts the whole fight or flight situation, which then starts a different chemical cascade in the body. And traumatic memory is saved, it's more implicit memory. So it's saved more in a sensory capacity than as a narrative. So if I were to ask either one of you to give me the story of, a happy time in your life, you'd give me that story. Where traumatic memory can be very much held implicitly and experientially. So it's not in that story format, and it's not stored in the same place in the brain, which then allows for flashbacks and triggers and intrusive thoughts and memories. And that brings us all to the symptomology of PTSD.
And so then what are the healing, can you describe then the healing process, what that looks like if it's sensory as opposed to narrative? Because that's, we're familiar with narrative and talk therapy. This seems to be taking us in a different direction.
Right. So again, like I had said before, the basis is safety, right? Someone has to feel safe. They have to feel safe in the room. They have to feel safe with you as the therapist. There's always a big emphasis on the therapeutic relationship, but most certainly in trauma work, you definitely have to be in tuned and attuned to that therapeutic relationship and how you are interacting with that person. I usually begin a lot of my work with just anxiety reduction. Post-traumatic stress is an anxiety-based situation. So we're doing a lot just to kind of keep people grounded, to keep them in the here and now within their own bodies. So I do a lot with mindfulness, like with emotional freedom technique, which is a biological like pressure point tapping situation. We do a lot with meditations, just rhythmic breathing, just knowing how to breathe to kind of stave off that panic attack. So we do a lot with that. And then, yes, because it is in the different brain, so just talking about it, just kind of normal talk therapy often does not do the trick. So what the EMDR is that it incorporates what we call bilateral movement. So it's either watching like eye movements or holding tappers that basically they do what their name is, they tap, but they do that alternating. So that mimics REM sleep. So it's stimulating the right and left side of the brain. There's also a lot of somatic therapies out there that really work with the connection of the body. So I try to bring in pieces of those because again, it's about the triggers and it's about getting to that implicit memory.
So you already mentioned some of the techniques that you use. Can you tell us a little bit more about maybe some other specific services that you or your colleagues offer at St. Luke's that will help individuals with that trauma healing process?
Absolutely. St. Luke's does have a series of mindfulness there is a mindfulness series done at St. Luke's. I think that's just wonderful because it really would speak to that anxiety. One of my colleagues also does like cognitive behavioral mindfulness techniques. She has a group. So I think that would also be helpful. Obviously medication, for some folks, they just, it gives that window of opportunity to be able to use the tools, that we're teaching in therapy. Obviously I'm EMDR trained. So obviously the EMDR, even the talk therapy on some level, depending on, kind of where you are within your trauma processing is also significant.
So with that
and for kids,
go ahead.
I'm sorry, for kids, it should be noted that there's trauma-focused CBT and sand play. And we do have a phenomenal therapist at St. Luke's who does some really, really good family and play therapy work.
Thank you for sharing all, thank you for sharing all that. What would be the first step then for someone to get services? What is a referral process for people in the community who will listen to this program and then would want to reach out to St. Luke's? Okay,
so for St. Luke's, calling our intake department at, I can give you that number if you so desire. That's 484-526-3012. That's the general intake. If they want to get to, I work in Bowmanstown, which is near Palmerton, and they can call our office directly, which is 610-826-1306. So those would be the two most direct ways in. I think if anyone is just looking for help in general, a domestic violence shelter, so Turning Point or Women's Resources, I live in Monroe County, so I know Monroe County too, is always a good. Crime Victims Council are always good places to start.
Okay.
Right, as well as your primary care. St. Luke's does a lot with integrating medical and behavioral health. So even going with your primary care doctor and speaking with your primary care doctor is a good first step in also.
And all of those entities know how to then help a person navigate and guide them to these services.
Absolutely.
That's great, because I think one thing that's overwhelming for an individual seeking help is they're so overwhelmed with life in general. Then the thought of, I have to figure out who to call and where to go and put all the pieces together, that's a whole nother feeling of being overwhelmed. So to be able to just make that one phone call and the person on the other end can give you that whole list of, this is how we're going to set you up, who we're going to set you up with, what you're going to get, and all that is really great. Any other resources in the community? So that's great. Turning Point, Crimes Victims Council, not just domestic violence, but I guess like support groups maybe that St. Luke's offers, or just other, resources or connections in the community that you might recommend?
I would think for kids and teens, remember your school system
is
a big part of that. Lots of schools, and actually St. Luke's has a school-based program. So they're like Bethlehem School District, Bangor School District, Northampton School District. They're actually clinicians in the schools. So I would say at the very least, if your school doesn't have a clinician in it, at least getting to the guidance counselor who can then kind of guide you in the right direction also. So again, for kids and teens, school is a big place.
Especially if kids are already viewing school as like their safe place, away from whatever's going on at home, then it's nice that those services, I think a lot of schools are really becoming trauma informed at this point and having those additional services because they are recognizing how much that mental and emotional support is really needed. In general, now more so. Any other thoughts or anything else, Christine, that you wanted to add, or Mark, any other questions that have come up for you that you wanted to ask her?
There is this,
I would just
go
say
ahead,
that,
Christine.
I'm sorry.
No, go ahead.
I would just say that if anybody is struggling, to reach out, get help. There are people out there are services out there. You know, all of us are committed to making sure that we get you to the
Oh, I think we're back.
We froze for a second. Everyone's
Just a
back?
second. We're good.
Okay. Okay.
Just how has the field of trauma treatment changed so that people, maybe if they have sought services in the past and maybe not had a positive outcome, maybe there's just, how has it changed so that maybe people might feel like this, they may want to come back and try?
I think it's changed significantly, especially again with all the trauma research that was able to be ascertained because of neural imaging. So yeah, I mean, and I think therapy has come such a long way with EMDR, with the somatic experiencing therapies. So I think in the last 10 to 15 years, there's been so much that we now know. There's so much that we understand about the brain. What I hear a lot from people is that they never went because there's this overriding feeling of being defective or irreparably broken or damaged. And a lot of what I do around the psychoed piece is just having them understand how trauma impacts the body, impacts the brain, and that their symptoms are really coming out of that, not because they are somehow irreparably damaged and can never be who they were before.
Yeah. Very hopeful outcomes for people, and empowering people because they can really understand.
I think that was a great question, Mark, because I think that does come up occasionally, how someone will have that first experience with therapy or even a doctor, and it just went so poorly that they completely give up on trying it again. So
yes,
it is a huge, that is huge to know that things do change over time, resources, research, how things are handled. So that's great. I'm glad you asked that. Christine, anything else that you would like to share with our viewers today?
No, just thank you so much. Thank you so much for the opportunity to talk about this.
Could you repeat those phone numbers maybe that you shared before?
Sure, absolutely. So for St. Luke's, for behavioral health intake, 484-526-3012. And then my office, because I have someone that schedules for me also, is 610-826-1306.
Wonderful. Okay, well, thank you so much for being with us today. I think this was a fantastic topic to be able to share with our community. Please keep us posted if there's any additional services or anything else that we can continue to share with our community. And to our listeners, please reach out. Christine shared the phone numbers. Reach out to us. There, like I said before, you are not alone in what you're going through. There's always someone out there willing to help. So thank you so much for tuning in.
Yes.
Thank you.
Thank you.